Good day everyone! We are the Group 2 and now we're going to show you on how to assess the 12 cranial nerves. But first, we should know what cranial nerves are. So cranial nerves are pairs of nerves that connect to the brain, to different parts of the neck, head, and trunk. And there are 12 of them, each named for their functions and structure. And it also has the corresponding Roman numeral from 1 to 12.
The olfactory nerve is the first of the 12 cranial nerve and is responsible for the sense of smell. Disturbance of the sense of smell may include hyposmia, or the ability of a person to detect odor is reduced, and anosmia is when a person cannot detect odor at all. Some people experience a change in perception of odors. Familiar odors become distorted or may perceive a not present smell. This occurs due to the peripheral damage of the olfactory nerve. In assessing the function of the first cranial nerve, the patient is in standing position or sitting position and is asked to close their eyes and identify odors. One nostril is held shut as each nostril is tested separately. Hold a coffee or clove under the patient's nose at a couple of centimeters distance and ask them to identify the smell and repeat the same process with another nostril.
It's a coffee.
Okay, how about the other side?
Yeah, it's a coffee.
Okay, how about this one?
No, that's a garlic.
Okay, on the other side?
Yeah, it's a garlic.
Sir, do you wear any contact lenses with glasses? No. So can you please read it for me from this letter with your one eye closed?
You may ask the client to read the Snellen type chart. Also, you may check your patient by checking the visual fields by confrontation and conduct an ophthalmoscopic examination.
Okay, that's all. Thank you.
Now for the next assessment, let's check for the cranial nerve 3 and 4, the oculomotor nerve and the trochlear nerve. The oculomotor nerve allows movement of the eye muscle, constriction of the pupil, focusing the eyes, and position of the upper eyelid. On the other hand, the trochlear nerve controls your superior oblique muscle. This is the muscle that's responsible for the downward, outward, and inward eye movements. First is we're gonna be looking for any involuntary shaking of the eye called nystagmus by placing my finger 14 inches away from the patient's nose. So sir, I want you to look at my finger and watch where I move my finger without moving your head. So, okay, thank you. Next is we're gonna check for accommodation, and in doing that, we're gonna make the patient stare at a distant object to help the pupil dilate. So I'm gonna take my finger and move it inward to the nose, and pupils should constrict while viewing a near object and dilate while looking at a distant object, and both eyes should move together. So sir, please stare off a distant object. Okay.
Hi, I'm Mary Elisa de Polonia, and today I'm going to perform the assessment on cranial nerve 5. The trigeminal nerve 5, or the cranial nerve 5, is both a sensory and a motor nerve which innervates all the muscles of pacification and mediates the facial sensation and the sensory part of the corneal reflex. In checking the trigeminal nerve 5, both the mandibular maxillary and the ophthalmic division should be tested symmetrically. So right now we're going to demonstrate the assessment on cranial nerve 5. So before doing the procedure, let us make sure to perform hand you're gonna have to ask your patient to close their eyes and let them say yes if they feel the sensation and no if they did not feel the sensation. Ma'am, I want you to close your eyes and say yes if you feel the sensation and no if you didn't.
Yes. 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 Yes.
So the second assessment is the feeling of sensation using the cotton ball stick. The same procedure, you have to ask your patient to close their eyes and let them say yes if they feel the sensation and no if they did not. Mom, I want you to close your eyes and say yes if you feel the sensation and no if you didn't.
Yes. 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 Yes.
The third assessment is the comparison between the cotton ball stick and the cotton ball. So the same procedure, you have to ask your patient to close their eyes and let them distinguish if we poke the cotton ball stick or the cotton ball. So ma'am, I want you to close your eyes and tell me if I poke the sharp one or the soft one.
Sharp. Soft. Sharp. Soft. Soft. Sharp. Soft. Sharp.
So the fourth assessment is to test for the corneal reflex. Take your cotton ball and ask your patient to stare off on whatever direction. Ma'am, I want you to stare off. And take your cotton ball and slightly touch their cornea. If the patient blinked, then the results are the response are normal. If the patient did not blink, then there is an abnormal response of it. So the fifth assessment is the motor function. Ask your patient to bite down. Ma'am, I want you to bite down. Then you're gonna have to take your two hands and feel their temporal and the masseter muscle. We're gonna feel their masseter muscle and the temporal muscle. You should feel a soft ball of muscle that is equal in size, equal on both sides.
Okay, now we're going to do an assessment for the cranial nerve number 6, which is the abducens or the movement of the eyes, which is also a motor nerve. The test for the extraocular movement is to detect if there is any weakness or if there is any uncontrolled movement of the pupils. Okay, so hi sir, I am your nurse, our student nurse for today. I want you to follow the movement of my fingers using your eyes only. Do not move your head or your neck, only your eyes, okay? Okay, so the patient successfully performed the assessment and the eyes are both equal and there is no involuntary movement of the eyes observed. Now we are going to do an assessment for the cranial nerve number 7, the facial movement and expressions, and also for the taste, which is also a type of motor and sensory nerve. Okay, sir, can you follow the different facial movements that I am going to say to you? Okay, so can you smile for me, please? Okay, can you frown? Okay, can you raise your eyebrows? Okay, can you puff your cheeks? Okay, good. Can you close your eyes slightly? Okay, thank you. So the patient has successfully performed the maneuvers with no uneven sides and no abnormalities. This time, I am going to put different tastes on your tongue. I want you to identify the tastes and the area of the taste, okay? So can you please close your eyes, please, so in order for us to know if you're okay, so okay. Next.
right now we're going to assess the cranial nerve 9 or the glossopharyngeal nerve. The glossopharyngeal nerve helps move out the muscles on the throat and carries information from the throat, the tonsils, the tongue to the brain. So in assessing or in testing the glossopharyngeal nerve, ask your patient to open their mouth. Can you open their mouth and say ah? And check if the ovula move up during their ah. Now we're gonna test the gag reflex. So we're gonna poke back there and elicit a gag reflex. So for the assessment on a glossopharyngeal nerve, my patient reacts to a normal response. And that's all.
Cranial nerve number 10, the vagus nerve, which is the longest and the most complex of the cranial nerves. The vagus nerves run from the brain through the face and thorax to the abdomen. It is mixed nerve that contains parasympathetic fibers. So, assessing nerve number 10 or the vagus nerve that assess the speech of hoarseness, which type of motor and sensory that functions as a sensation of pharynx and larynx, swallowing, and vocal cord. So first, ask the patient to swallow and speak. Sir, can you please swallow? Sir, can you please repeat after me? E-O-U. E-O-U. Thank you, sir. So the patient should be able to swallow without difficulty and speak audibly.
With the patient in sitting position, inspect the neck area for atrophy. If none, ask him to shrug his shoulders and resist with his strength. Next, you can ask the patient to turn head to the side against resistance from your hand and repeat to the other side.
We are now on the 12th and the last cranial nerve, the hypoglossal nerve. The hypoglossal nerve innervates the tongue muscles and are responsible for the movement of most of the muscles in your tongue. It starts in the medulla oblongata and moves down into the jaw where it reaches the tongue. If there are problems with the hypoglossal nerve, the tongue will become paralyzed. To test the nerve's function, a patient will be asked to open their mouth to inspect the tongue for atrophy and fasciculation. Okay. Next, the patient is asked to stick out their tongue and check for deviation. Okay. If paralysis were present, the tongue would point in the direction of the affected side. Another test monitors the strength of the tongue by having the patient press their tongue against the side of their cheek while you press against it. How about the other side? Okay. The doctor can tell how strongly the patient is pressing, and eventually the tongue will begin to atrophy or shrink if the hypoglossal nerve is permanently damaged.
So that ends our demonstration for the cranial nerve assessment. Of course, after doing all the tests, we should summarize the information to the patient, perform aftercare of the equipment, of course, perform hand hygiene, and of course, document the findings of the procedure. So again, this is Group 2 and thank you for watching.